Estrogen is a really tricky hormone because it's so powerful for the body. It gets a really bad rap. Truth is, all the testing we've done of aromatase inhibitors that suppress estrogen levels has gone horribly wrong. Suppressing estrogen is not a good thing, even though sadly a lot of doctors are still doing it, and probably won't stop in the short term, which is why if you're doing hormone replacement, if you're doing hormone manipulation, you really need to be working with a smart doctor. I don't know anyone who's on the cutting edge in that space who's still using supplements like DIM, supplements like, and that's diindolylmethane for those of you who don't know, supplements, or not supplements, but aromatase inhibitors like anastrozole. But what you'll see is that people will blame those symptoms on estrogen. And the reality is we'll see the copper then come out and the symptoms get better. And it's remarkable just how consistent that is in practice.
I also think sort of diving a little more deeply into calcium metabolism is also very interesting, because by default, you have to dive more deeply into hormonal, the hormonal regulation aspects of calcium metabolism, right? And there's also interactions between the metals and calcium. And when we see, one of the biggest associations that I see on a hair test is when someone has a really high calcium level, and that almost always usually coincides with an imbalanced calcium-potassium ratio, which is impaired cellular effective thyroid hormone. What I almost always see is co-occurring copper, aluminum, or lead toxicity. And especially with aluminum and lead, these two elements, they've demonstrated in the literature that those two elements can drive calcium out of the bone tissue where it should be, right? And this is sort of putting our toes in the water a little more deeply into calcium metabolism and calcium partitioning. Calcium should be in the bones and teeth primarily, a little bit in your muscles, a little bit in your brain.